Good evening, and welcome to those of you that have joined our call tonight. Even though we are still dialing people, we're going to go ahead and get started. My name is Greg Thompson, and I'm the Executive Director of PASS, the LA County Public Authority. And I would like to welcome you and thank you for being on our call tonight. Tonight, we're going to pick up with our series on the discussions on CalMedi Connect. If you've missed any of our three discussions on CalMedi Connect, you can find them on our website, www.pascla.org. Again, that's www.pascla.org. Now, with that said, I'm going to take a few minutes and go over some of the specifics about tonight's call. If at any time you would like to ask one of our presenters a question, simply press *3 on your phone. Again, if any time throughout tonight's call you'd like to ask a question, simply press *3. And we encourage and welcome your questions, so please press *3 to ask your questions at any time. Now, not all of the callers' questions are going to go live in this next hour. However, if your question does not get answered tonight during our call, someone from PASC will return your call. We will also be asking you questions. Now, how this works is I'll ask a question followed by some possible answers. You will select the number on your keypad that corresponds with that answer. For example, if I were to ask you, what day of the week does Easter fall on? Then I would give you three answers, and you'd pick the correct one. I'd say press 1 for Thursday, press 2 for Friday, press 3 for Sunday. And so you'd press number 1, 2, or 3 on your telephone keypad. And at the end of the call, you will also have a chance to leave a voice recorded message, comments, questions, and someone will return your call. So as usual, we have some great guests with us tonight. We have Eileen Harper, who is the Executive Director for the Center for Healthcare Rights. Eileen, thank you for joining us tonight. Eileen, I see that the HICAP number is on all the state literature that they've been mailing out. I hear it on the telephone number given out on all the telephone conferences. Can you please tell us a little bit about how HICAP is involved with CalMedi Connect?
Sure. And again, thank you, Greg, for inviting us to participate on this call. The HICAP program is the Health Insurance Counseling Advocacy Program, which is a statewide program that provides assistance with Medicare and Medi-Cal issues. It's a statewide program funded with both state and federal funding. Our agency, the Center for Healthcare Rights, has the HICAP grant for both the City of Los Angeles and the County of Los Angeles. And we, in fact, have the largest population of folks with Medicare and Medi-Cal who are affected by the new CalMedi Connect program. So as the HICAP contractor, our phone number, our HICAP phone number is listed on all the notices that people will be getting, as well as the enrollment materials as a resource if people have questions relating to CalMedi Connect, particularly with regard to enrollment, choices that they have in terms of whether they want to enroll into a CalMedi Connect plan or opt out and keep their Medicare and enroll into a Medi-Cal plan. So if people have questions about the notices that they're getting, if they have questions about how to fill out the enrollment form, if they feel confused and really don't know what to do, they can give us a call, speak with one of our counseling staff, and get some guidance in terms of what options are available and sort of help navigate what the enrollment process is going to look like. We don't tell people what to do, but we will give them guidance in terms of what the enrollment options are and what decisions they do need to make before they are passively enrolled into a plan. We can also help people look at whether their doctor is a CalMedi Connect physician and participates in a particular CalMedi Connect plan. We can give them some guidance in terms of the Medi-Cal plans that are available if someone chooses to keep their Medicare rather than going into a CalMedi Connect plan. And if they believe that they are having a problem, for example, let's say they are enrolled into a CalMedi Connect plan, didn't really understand they were going to be enrolled, and they need help getting out, we can help them do that as well. And our 800 phone number for all of you is 1-800-824-0780. Again, 1-800-824-0780.
Thanks, Eileen. And I know that you guys are busy. I hear that you're getting a lot of phone calls, and are we ready for our first poll question, Julie?
Yes.
Okay. So remember how I described the question? We're going to do that now. So the first poll question is, how do you like to receive important information regarding your health care benefits? Press 1 if you like it by mail. Press 2 if you like to receive it in teleforms like this. Press 3 if you'd like to receive it by email. Now I'm going to ask the question again because we want to get as many people to answer it. How do you like to receive important information regarding your health care benefits? Press 1 for mail. Press 2 for teleforms like this. Press 3 for email. I'm going to give you guys a chance to do that. This information is very important to us because there's been a lot of discussion and a lot of confusion about all the information that's been sent out, and we want to help them try to get it right. Okay. So now what we'd like to do is take some live questions, and we have Rennie. Are you there? You want to ask your question for us, please?
I'm here.
Hi.
Hi, how are you?
I'm good. How are you?
A little frustrated. I don't have a computer, nor do I even have the knowledge to get on the internet and go to a website. I'm a senior disabled, and I would like to find out, I've missed all your other calls, your other conferences. Is there a way that I can get a transcript of everything? Because I'm not going to be able to hold on more than another 10 minutes. And I have missed all the other conferences.
Well, I'm sorry that you missed them. If you hit *9, you'll be able to get a transcript. You can talk to one of our people, and we'll get you a transcript. But I encourage you to hang on as long as you can, because hopefully there'll be some good information. Do you have any other questions?
The problem is I'm on my way to a meeting right now that I have to go to, and I have no choice, and it starts in 10 minutes.
Okay.
Well, Thursday evenings or Wednesday evenings are really bad for me.
I'm sorry about that. Well, thanks for joining us on this one. Okay, I think we're going to go to Roya.
Hi.
Hi.
And me, I have a lot of bad things wrong with me, diabetes, and I have IBS. I don't know if you know what that is. And I can't go nowhere to restaurants or anything like that because I'll have to just let it out right there. You know, I can't hold my poop, okay? And so I'm eating right now, so in a minute I'm going to have to go just like that lady. But that 1-800 number, 1-800, it says 82407 something something. I didn't get the last numbers.
Okay, let me repeat it. It's 1-800
Yeah.
824
Wait, 824?
0780.
Yeah. 80. Okay, that's what I needed. Thank you.
You're welcome.
1-800. So they'll help me. See, I just wanted to know if am I going to get some Medi-Cal or Medicare, because I'm going to be 61 in a few days, and or am I going to stay on Care First?
Yeah, we can help you with, if you have other questions relating to your Medicare, Medi-Cal, we can help you with those as well. So give us a call.
Oh. Okay, that number though, right?
Yes.
Okay.
Does that make sense?
Yeah, I got it now. See, I'm disabled a lot in the brain. You know, from my younger days. That was good, I know. That's right.
Thank you for calling. Okay, Linda, would you like to ask your question, please?
Hi. If I have choose a Medicare option, do I have to choose one of the MediConnect plans, or can I choose another HMO that will take Medi-Cal?
I'll let Eileen. You understand?
Yeah. Okay. So your question is, do you have to choose a Cal MediConnect plan, or can you choose another Medicare Advantage plan, or are you asking about a Medi-Cal plan?
I'm asking if I can choose another Medicare Advantage plan other than one of the Cal MediConnect ones.
Yes, you can. Yeah.
Okay, that's good. Okay.
Now,
okay.
but I do want to clarify that if you choose a Medicare Advantage plan that is not a Cal MediConnect plan, you do need to enroll into a Medi-Cal plan as well. So I know that sounds confusing in terms of being in two managed care plans, but if you are in if you're in a Medicare Advantage plan that is not Cal MediConnect, you also have to be in a Medi-Cal plan. And if you want us to talk more about that, we can do so, if you give us a call.
Oh, okay, thank you.
All right, thank you, Linda. All right, Patricia, welcome. Would you like to ask your question, Patricia?
Yes, I would. I'm 65, diabetic. I have arthritis throughout my body. I have a degenerative cartilage of the knee. I have a rotator cuff that gives me pain all the time. And but more importantly, back in June, my primary physician's office manager told me that I better hurry up and pick a Medi-Cal managed care or an HMO, or they're going to choose for me. Now, my birthday's not until September 1st. She was misinformed, and I went ahead and selected one. So it started in July. Because I have about 4 or 5 specialists, they don't take HMOs. So I'm upset with the fact that she was misinformed. And I'd like to know who is the one that informs the doctor's offices? Do they get letters from Medi-Cal, MediConnect, the offices, or where did she get her information that was mistaken?
There is so much information circulating. It could have come from anywhere, but it sounds like the information was incorrect. Do you have Medicare, or do you have Medicare as well?
I have Medicare as my primary.
Okay.
And I have I had regular Medi-Cal, so therefore I was able to see the doctors that I needed to see that would take that. They don't take HMOs. It's like you have the plague or something when you mention an HMO.
So I spoke to a woman today from United Healthcare. Are you familiar with that?
Yes. But they're not one of the CalMedi Connect plans.
They aren't. Okay, does that mean if I was with them, I would also have an CalMedi Connect, what is it? Yeah, HMO, Medicare HMO?
Yes, Patricia.
Okay, Patricia?
Yes.
Okay, so just to give you a very brief answer, if you join a Medicare Advantage plan, not a CalMedi Connect plan, if you join a Medicare Advantage plan, you want to first make sure that your doctors are part of that plan before you want to enroll in there. So that's my first response.
Yeah, well, that's what she's having. She had me, her name is Dorothy. No, it isn't, it's Beverly. Anyway, I'm getting old. Anyway, it's, she said, make a list of all your doctors and we'll see if they're in the plan. So that's what I was working on today.
I mean, I think the problem that you originally identified was that you are in a Medi-Cal plan now. If you want to get out of that Medi-Cal plan now, you can do so. You don't have to be in that Medi-Cal plan right now. So that's something that you might want to consider. But I would urge you to give us a call, to give our agency a call. And again, the 800 phone number is 1-800-824-0780.
And what are the hours for that?
9 to 5.
Monday through Friday.
That's correct.
This is also very complicated. A lot of these people, like in my dermatologist office, I asked her if she was familiar with this new CalMedi Connect, and she said no, she didn't know anything about it. And I'm guessing because they have other billing offices that that do the billing, they farm it out, so they don't know. I'm trying not to be so upset with my doctor's office manager, who gave me such wrong information. I was just doing what she said, and what you're saying now is I can call the 800 number, and I can do what? I can opt out of what I have now, and I don't have to do anything because my birthday is until September 1st, because my birthday is September 1st.
What I'm saying to you is I would like you to give us a call so that we can outline what your options are. You have different options, but if you want to disenroll from the Medi-Cal plan, we can help you do that.
Thank you very much for your call. Okay, we're going to assume that you've received a letter from the state stating that you will receive your health care benefits from one of the health plans, or let's say you've chosen a CalMedi Connect plan already. I'd like to take this opportunity to introduce Dan Salo who is a product marketing director for the duals with CareMore Health Plan. Dan, can you tell me what happens after one receives such a letter or does choose a plan? It seems like there's a period of limbo and people are unsure what they can do. Can you kind of walk us through what to expect?
Sure, Greg. First of all, I want to just thank you for inviting us to join you this evening, and also recognize Eileen and the wonderful job that HICAP is doing to help folks like Patricia in understanding this program and what their options are. Patricia's right. It is a little confusing, and this is new, and what maybe we can do today is talk a little bit about CalMedi Connect and what value it may bring so that folks would understand that in addition to choosing your doctors, with CalMedi Connect, it's also a model of care in system of care that's a little different than what they may be getting today in the traditional fee-for-service world. First of all, just to clarify, what CalMedi Connect does is brings their Medicare and their Medi-Cal benefits together all in a single plan. So ideally, the right hand knows what the left hand is doing. And what will happen, as many of your folks may experience, is depending on their date of birth, they'll receive a series of letters from the state, starting 90 days from their date of birth, 60 days, and 30 days. And in those letters, they'll explain to the person that CalMedi Connect is one of their options, and there's a form that they'll have to fill out to indicate what their choice is. And they also have the choice of not doing anything at all. And during that limbo period, it's a great time to call HICAP and have things explained to them so that they know what their choices are. And if they choose to join a CalMedi Connect plan, the state will recommend the plan that best suits their current provider network. The state is using something called intelligent assignment. What that really means is a fancy name for trying to link people up to the health plan that has most of their doctors. May not have all of them, but they're trying to recommend plans that have either their primary care doctors and or specialists who they've seen in the last year. They're trying to link them up to the plan where those doctors reside. In some cases, if they haven't seen a doctor right away, then they may not be part of their network. But like I said, they may not have 100% of their doctors, and that's where Eileen or the individual plans can help identify what doctors are part of their network. But the first thing that really happens, and how CalMedi Connect is a little different, is we have a model of care and a coordinated system of care, whereby the first thing that we do is conduct a health risk assessment. And in that, we really want to get to know the individual so that we can begin a more proactive approach towards healthcare. And this is really different. You know, what we traditionally do is wait until we get so sick to call the doctor, and by then it's often, you know, there may not be a lot we can do, or it takes a lot to get somebody to feeling better. So we would rather see our CalMedi Connect members early and often, so that we can identify any underlying things that may not be, you know, may not have surfaced yet. So at CareMore, and I brought Victoria with me. She's our nurse practitioner. She's the one really responsible for the health risk assessments. And in that process, we're able to identify a lot of things that may be hidden. And in fact, I'm going to turn it over to Victoria to maybe, you know, share one of her stories about how when one of our patients went through the health risk assessment with diabetes and how we were able to help them.
Sure. Thank you, Dan, and thank you so much for having me here. So what we do for this type of visit, what we call it at CareMore would be a Healthy Start visit. What we do is a health risk assessment and a comprehensive physical exam. We like to bring our patients in so that we could see them. We check their labs. We also look for any history or physicals on the patient. We also look at their medications. And what we use for this is it's a way for us to identify any current patient needs. We identify if a patient has diabetes. We identify if they have hypertension or high blood pressure. We're able to identify if they have any kidney issues. We're able to identify these patients and place them into some of the special needs programs we have with CareMore. Some of these special needs programs we offer would be this telemedicine program. For instance, I had a patient who had high blood pressure. They came into the clinic. They had no idea what types of medications to be taking. They were recently discharged from the hospital, however, not taking their medications because the medications they took at home were different from the medications prescribed at the hospital. So what we did is we enrolled them into our telemedicine program. And what that is the patient takes a blood pressure cuff home and they check their blood pressure daily. And we're then able to monitor them from their house to look for trends and to see if there's a high reading where we need to provide an intervention, such as prescribe a medication over the phone or bring them into our care center to make sure that they're doing okay. And with this said, it provides some comfort to the family members as well, because they know that their loved ones are being managed, even though they're at home.
Greg, I would even add that one of the callers talked about her inability to get out and to travel very far from her home because of her problems. At Caremore, if there's a home health need, our nurse practitioners, similar to Victoria, they'll even go into the homes. And in fact, I was out in the field one day with one of our nurse practitioners who went to a person's home who had diabetes for the sole purpose of counting her medications and filling her insulin syringes. Because while it seems like a simple thing, we know someone that may have the shakes, may not be able to measure that insulin very correctly. And we know if somebody isn't dosing themselves properly, they may have problems and perhaps end up in the hospital. So it's worth it to the care plan to invest in providing nurse practitioners to visit individuals who otherwise might have challenges down the road. And so it goes so far beyond the doctor. While the doctor is the primary relationship and we don't replace the doctor at all, we provide additional support above and beyond the doctor.
One of the things, Dan, that we're hearing a lot, people are really apprehensive about having to join a health plan. Mm-hmm. And I know that when Medi-Cal and Medicare have put certain quality of care standards in place, we're going to ask a poll question, but then I want to come back to that and maybe you could describe some of those. So we're going to go to our second poll question. And again, I'm going to read the question to you guys. I'm seeing number 3 out there, but it's the second poll question. Sorry, you guys. I'm going to read the question slowly, and then you'll be able to indicate your answer by pressing either 1, 2, or 3 on your telephone. So here's the question. Which one of these statements do you agree with the most? Press 1 if you are seriously considering joining a CalMedi Connect plan. Press 2 if you still have not made up your mind about joining a CalMedi Connect plan. Press 3 if you have already decided to opt out of CalMedi Connect. So let's try that again. Again, these are important information for us, so I'm hoping you'll all make an effort to answer the question. Here it is. Which one of these statements do you agree with the most? Press 1 if you are seriously considering joining a CalMedi Connect plan. Press 2 if you still have not made up your mind about joining a CalMedi Connect plan. And press 3 if you've already decided that you're going to opt out of CalMedi Connect. Okay, thank you for that. And I wanted to back up, Dan, just to my question about the quality of care standards. Can you kind of briefly lay those out for us?
Real briefly, I think this is one of the other neat things about CalMedi Connect, in that it took 2 to 3 years between the state and various stakeholders and physicians to come together to design this plan. And in that process, they put a number of quality standards that the health plans must meet. Otherwise, they're penalized, and they're penalized financially. And they're the standards are very customer service and patient-oriented standards. For example, the care assessment, as I said, is a very important first step in the process, and we have to report to the state how many did we complete within the first 90 days. We have to, there's member service elements. When they contacted member services, did they get the information that they requested? There are they also survey more members to ask how difficult of time did they have in trying to get their appointment? Were they able to get their appointments in a timely manner? And if not, that data is all goes to the state, and if we don't meet the minimum standards, then they will penalize the plan financially. So there's a lot of, and that's just a couple of them. But it just gives you a sense that there's a lot that's gone into CalMedi Connect to make sure that it's going to be a beneficial change for those who join it. And it's not just switching from what they have today to something else with a different name. It's really about a different approach to healthcare that has a lot more support and coordination as opposed to just doing it by yourself. You don't have to do it by yourself anymore.
Thanks, Dan. I want to remind the callers, again, if you have a question, you can press *3 at any time and talk to one of our screeners. We're going to give you guys a chance to do that. I wanted to go back to Victoria. One of the things I know you guys do is the quality risk assessment, and you talk about being proactive. Can you give us an example of maybe a case where, you've been proactive, you've done these tests, and you've been able to make a difference with somebody?
Sure, yes, and thank you. So I had a 76-year-old male gentleman that came to the care center. He was diabetic. He didn't know he was diabetic, and upon doing our assessment, which we do, which CareMore does at our Healthy Start visit, I noticed that he had some wound ulcers on the bottom of his feet, which he was not aware of, because with diabetes, sometimes you lose that type of sensation, and you don't always check your feet daily. In identifying those ulcers, we were able to provide early intervention and treatment. We enrolled him in our wound management program, and we saw him weekly until those wounds healed. Unfortunately, what happens with these wounds is sometimes they don't heal. They go on for a very long time, which may cause amputations, and in this way, we were able to save his limb.
Thank you. Okay. We have some people in our queue. All right. Marla, thank you. Hi, Marla. Would you like to ask your question?
Yes, good evening, sir. Thank you for taking my call. I am 72 years old, and I have cancer twice already. I have one kidney. Because of a lot of sickness I have in my life, I do have many specialists. I already spoke to some of them. And let's say my primary doctor accepts LA care, my endocrinologist accepts CareMore, and let's say all my doctors for kidney and etc., they are in Cedars, they need to accept it only Medicare partners. How in the world I am able to coordinate all this when I have 20 specialists? I cannot have another very new doctor. If I've been with them for 30 years already, they do my surgery, and I'm waiting now for another surgery of my left kidney, left knee. I just have right knee done. How I am going to coordinate that? Who is the one who could help me with that? If anything can be done, how can I switch to be sure that I'm still going to be in the same hospital?
Thank you for that question.
Probably a lot of people have the same problem.
I would just say this. Number one, you do have choices, and you can always stay with your current Medicare and select a Medi-Cal program if that's your choice. But also with CalMedi Connect, and this is part of what happens in the health risk assessment, is we want to identify if you do have any treatments or scheduled surgeries and things like that, because we do understand that we don't want to interrupt that care. And if your doctor accepts payment from the plan, you would be able to continue to see that doctor for 6 months. So that if you have anything scheduled right now, the plans will work with the doctor. You'll be able to complete your treatments, complete your surgeries, as long as the doctor agrees to accept the payment from the plan. So we'll do everything that we can to not interrupt your care, because that's the last thing we want to do.
Okay, again, I understand that 6 months, but what's going to be after 6 months? I cannot push any doctor to accept that something what he says he doesn't accept.
Well, I understand, and what we'll do is we'll speak with your doctors and eventually, ideally, try and get them to agree to become part of our plan. Now, if they choose not to, that's their choice, and at 6 months, you too would have the option of disenrolling and not being part of Telemedicine Connect anymore. So you have a lot of freedom, but I understand you have a strong relationship with your doctors and where you may not want to leave that doctor. But I would also say that there are a lot of very, very good quality doctors within these networks, and that health plans can help you find a doctor that may be a secondary doctor that you would be willing to accept. But I understand if you see a lot of doctors, it may be a challenge. But we'll help you, accommodate you, and support you any way we can.
Thank you for that question. Let's go to Nicole. Welcome to the call.
Hello. Thanks for taking my call. I am a little bit confused with the whole program because I've recently taken over as a caretaker for my grandmother, and my brother passed away who was taking care of all of this. So I took her to the doctor at UCLA. She's been seeing this primary care physician for years. All of a sudden they told us maybe 6 months ago or so, well, with her insurance, LA Care, she's going to have to pay for this visit because we don't accept HMO, and my grandmother has Medi-Cal, Medicare. As far as I know, she's had LA Care for years. They're telling me that they probably automatically enrolled her in LA Care, and that's why all of a sudden now they're not accepting it. I mean, if I remember correctly, she's had it. What I don't know is, like, I've gotten all this paperwork that I need to change her. If I don't change her, then I guess she's going to stay the same. I don't know. I need to know, like, this Medicare Tech Connect sounds great because it streamlines her Medi-Cal and her Medicare. But how do I find out, like, if all her doctors are covered? What is the best choice for her? She's 89, doesn't go to the doctor all the time, but at least enough every 3 months. And when did it all change? Why did UCLA just change? You know, they weren't able to really answer any questions for me. And I don't know what the best decision to make for my grandmother.
Well, I'm going to let Eileen take a shot at that.
Okay, so, you know, just based upon what you said, it sounds like your grandmother was probably in the LA Care Medi-Cal plan. And anyone who was in the LA Care Medi-Cal plan in July was enrolled into the LA Care CalMediConnect plan unless they chose something differently. So I'm not sure who was in charge of your grandmother's affairs at that time.
I was at that time, and I don't think I did anything unless the social worker in her building changed something. But he's the one who told me that I need to look into it. So, you're saying that she...
Okay, so right now she is in the LA Care CalMediConnect plan. It sounds like at least this particular doctor does not take the CalMediConnect LA Care plan. So what they're telling you is that they are advising you to disenroll her from the plan. Now, if you do disenroll her from the LA Care CalMediConnect plan, she can go back to original Medicare, and but she does need to be in a Medi-Cal plan. So if she was previous in the LA Care Medi-Cal plan, she could just go back to that. But if you want more, you know, a more detailed discussion of this, please give us a call. And again, the 800 number is 1-800-824-0780.
Thank you. And again, if you'd like to ask a question, just press *3. Randy, welcome to the call. Would you like to ask your question?
the 6 Medi-Cal only plans that are available to people?
Yeah. Randy, you're asking what are the 6 Medi-Cal plans?
Yes, for Medi-Cal only.
Okay. All right, so Randy, the 6 Medi-Cal plans are LA Care, and the partner plans are Blue Cross, Care First, Kaiser, and then there's Health Net, and their partner plan is Molina. So those are the 6 Medi-Cal plans for LA County.
Okay, thank you, Eileen.
Thank you, Randy.
Jackie, welcome to the call. Would you like to ask your question? Are you there, Jackie?
Hello?
Hi. This is Jackie.
Hello?
Hi, Jackie. You want to ask your question?
Yes, I'm 65 years old, disabled, and I have a lot of autoimmune diseases and a lot of surgeries. And I have been very well taken by Medicare and Medi-Cal, and I don't want to change I don't want to drop my Medicare for CalMedi Connect, and I don't want to have an HMO. I want to stay Medicare and Medi-Cal because I have choices, and this is I feel like it's being forced, and I can't afford anything that my insurance doesn't cover. And every doctor because I go to a lot of different specialists, every doctor that I've asked about the HMO plans, like my Medicare and then an HMO, they don't accept any of your plans. So it's very upsetting to me. I've called every number that's out there. I've listened to your things like this phone thing, and I don't know what the cutoff date is, but I'm very upset that I'm being forced into making a change that I do not want.
Thank you for your question, and I understand your frustration, and you're not alone. Eileen, do you want to just review what her choices are?
Yeah, I mean, I think it sounds based upon what you said so far that you pretty much know what your choices are. I mean, your choices are to go into a CalMedi Connect plan, and again, there are 5 CalMedi Connect plans.
I don't want to even hear about CalMedi Connect.
And you don't want to do that. Your alternative would be to keep your Medicare, but enroll your Medi-Cal into a Medi-Cal plan. Now, if you do that, if you keep your Medicare, you can still see your doctors because they're going to bill Medicare for your services. So even if you do enroll into a Medi-Cal plan, that Medi-Cal plan is only going to control your Medi-Cal benefits.
Okay, but
isn't going to control your Medicare benefits.
Okay, but what I'm saying is if Medicare pays 80% and my Medi-Cal paid 20%, I didn't have to pay anything because I don't have anything on.
Right, and if you join a Medi-Cal plan, you shouldn't have to pay anything. Your doctors and other medical providers will need to understand that they don't have to contract with the Medi-Cal plan in order to bill them for the 20%. Okay,
so in other words, you're saying that I could, so what are you saying that I need to do? Because I've gone over this with everything and everybody, and my doctors won't accept just what Medicare, they're 80%.
I understand that. Okay, so what I'm saying to you is that you can continue seeing your doctors if you have original Medicare.
Yes.
You can be enrolled into a Medi-Cal plan, but your doctors need to understand that they have to bill your Medi-Cal plan. They cannot bill you. That's illegal.
Medi-Cal, they have to, but my Medi-Cal plan as what? As they normally have, or?
They would bill, okay, actually, there is some information available now on how doctors can bill the Medi-Cal plans. And if you give us a call, we can actually send you a fact sheet that talks more about this. So, you know, we don't have enough time, unfortunately, today to get into the details. But, you know, please give our agency a call.
Okay, and what do I ask them when I call?
When you call, schedule an appointment to speak with one of our counselors and tell her that you're particularly concerned about the provider billing the Medi-Cal plans.
Provider billing Medi-Cal plan.
Right.
Okay, and then they'll be able to help me?
Yes, but you have to make an appointment to speak with a counselor. So when you call in, our receptionist will take your name and phone number and schedule you for an appointment for a call back.
Okay, now this has nothing to do with Obamacare then? This is separate?
Not directly, ma'am. Not directly, no.
And why is this like being forced on us?
Well, I think the state is hoping that they will sort of accomplish two things. One, improve the quality of care for people with Medicare and Medi-Cal. That's one goal. The other goal is the state hopes that they will also save some money.
Now, is it true that Medi-Cal is going bankrupt?
I don't think Medi-Cal is going bankrupt, but the Medi-Cal program is very, very expensive. So the state, you know, has had some financial problems previously. So the state is very concerned that the Medi-Cal budget be controlled and that we don't spend money unnecessarily.
Okay.
Thank you very much for that question. We're going to take our last poll question, and then hopefully after that we'll have time for some more live questions. So again, I'll read you the question, and all you'll have to do is push 1 or 2 on your telephone. Here it is. If you would like more information about CalMedi Connect, press 1 for yes, press 2 for no. Again, if you would like more information about CalMedi Connect, press 1 for yes, press 2 for no. Well, do you have any live questions for us, Julie? Brooke, how are you? Would you like to ask your question?
I'm on HealthNet and WellCare, and I was on Medicare for years and years. I have osteogenesis, brittle bones. I've had 89 operations, 2,000 broken bones. So I have to go to specialists all the time. And currently, right now, I'm on HealthNet and WellCare, and I'm at the donut hole right now. So it's really affecting me financially to have to pay so much more for prescriptions. And they said the donut hole doesn't go away for like, 6 months? And I don't really know a lot about it, sir, because I only went to the 8th grade. So I apologize for my ignorance. But I just don't understand why I don't get Medicare anymore, because I was getting it for years through my father, because he was in the war. And I don't know, because my father died, is that why they took me off it?
I'm going to let Eileen take a shot at that, but you don't have to apologize for your ignorance. I know physicians and PhDs that don't understand this program, so we're all kind of in the same boat.
Okay, so let me make sure I understand. You have the WellCare Classic plan? Are you in WellCare?
I'm on HealthNet and WellCare. One is for Part D for my prescription, and the other one is for the hospital.
Okay, so you don't have Medicare Part B as in baby.
Well, it says that I have Part A and Part B on my Medicare, but every time I show them this card, they say it's no good.
Okay, all right. Now, do you have Medi-Cal, the state program? That's
No.
the white blood. No, you don't have Medi-Cal.
No, and see, I'll tell you the reason why. Okay, when my mother passed away, she left me a little bit of money. Okay, it wasn't a large sum. It was just enough for me to not eat Meals on Wheels. You know what I mean? And I'm stressed out. I don't know what to do, and I'm happy you guys gave me a call, and hopefully you can help me go the right direction.
Right. Well, I think that you should give our agency a call because it sounds like your primary concern is your prescription drug costs, and
Yes, ma'am.
there are some things that we could talk with you about. So
Okay.
please give us a call at the 800 number, and again, it's 1-800-824-0780.
Thank you for your call. You're not alone out there. Everybody is really confused with this. There are so many questions to be answered, and that's why we're really pleased that CareMore is sponsoring these calls so that we can give you an opportunity to ask your questions. We have time for maybe one or two more. No? Okay. Well, I have one question for Dan before we go then. As you know, that there are 60% of the home care workers are family members. Can you tell us how CareMore plans to integrate the family care givers into the coordination care teams?
Yeah.
That's a big topic.
Yeah, and I'll also have Victoria tell you a quick story, but quickly, we're required to create individual care teams. And those care teams are comprised of any physician or home care worker or caretaker that may be involved in your care, because we realize that for you to have the best outcomes and the best treatment is that you need the support from all those key individuals in order to follow your programs. But more importantly, I want to have Victoria share a story with how she was able to help a daughter who was caring, or a sister who was caring for her brother, and how she was able to help them.
Yeah, so I had a patient come in to see me the other day, and she was the caretaker. Her brother was disabled. Their parents had passed. Unfortunately, she started struggling with some health issues of her own, and so she was having trouble taking care of her brother. So she came to the clinic. She was really distressed. She started crying. She was very frustrated. And so we were able to actually get case management involved and refer this patient to case management to assist the sister with helping the brother with prescription medications, to providing an attendant to come with him to the clinics, and just to relieve her a little bit so that she could take better care of herself, so that she could take better care of him.
So the sister didn't know about the in-home support services,
Mm-hmm.
and we were able to identify the need and be able to make those services available to make her life and her brother's life a little better.
I'm glad you mentioned in-home supportive services. There are a lot of younger people with disabilities who really are, they really believe in the self-directed model. How do you see that fitting into CalMedi Connect, and specifically, how will CareMore approach that in protecting the independent provider mode?
Well, one, from a health plan perspective, we're very supportive of the HSS program because two things. Number one, just to rest people's fears, the IHSS program remains that it is for at least the first year of the program, and they've yet to really define how it might be modified going forward. But we believe in the program because it allows individuals to remain in the home for as long as it's in their best interest. And we know without the services that are provided through the program, many people would otherwise have to go to a facility, and most people would prefer to be in their home amongst friends and families and receive care from those that they trust. So we're a big supporter of the program and all that it does to allow people to live with dignity as they age and be able to function within their home and within their communities.
Thank you. Well, I think we're about out of time. I want to thank care more. I want to thank Dan and Victoria for being on the call and also for sponsoring these calls and helping us get the information out. And I also want to thank Eileen for being on our call for the second time and remind everybody that, you know, HICAP is the number that you want to call if you have any questions. And if you want to hear some of our previous calls, you can go to our website, as I mentioned earlier, which is www.pascla.org. And I'd also like to thank the staff here at PASC who are manning the telephones. And I'd also like to thank our governing board who lets us, encourages us to do these calls. So thank you very much for being on the call tonight.